Hello, I'm Dr. Kaczynski, and this is Plastic Surgery One-on-One, your internet source for plastic surgery questions and answers. Today, we're going to talk about sizing for breast augmentation. It's a very good topic, especially this week, since in the past week I've spanned the gamut of breast augmentations that I've done from 250 cc's to 700 cc's. And one of the biggest questions that people have when they come in after they've made up their mind to have the surgery is, what size do they want to be? And this is a question that people devote a great deal of time and energy to. And over the years, we've used various ways to help determine the size. Now people also go on the internet, and I've had patients come in with a stack of photos that they like, they don't like, they like, they don't like, and they go through them one by one. People also bring in photos from like Playboy magazine. All of those things are helpful. We also do actual sizing with actual implants in the patient's bra, and we'll talk about that in a minute. The first thing to talk about is, what is a cup? And that's actually a more difficult question to answer than you would think. There isn't really a gold standard cup size in the Bureau of Weights and Measures in Washington, D.C. The problem is that the cup size is related to the chest size, to the circumference. And there's a formula where you take the number of inches of the chest circumference and the number of inches across the nipple area, and the number of inches difference actually gives you the cup size. In addition, a 34C cup is basically the same as a 32D or a 36B. Compounding that, most women don't wear their correct fitted bra size for comfort. They either wear it looser or tighter, and they wear it for the sensation and the support rather than actually fitting their size. So that's why it gets rather complicated if you're not sure where you're starting from. In general, a cup size, if you're looking for numbers, is between 1 and 200 cc's. So what other factors also go into selecting the size of the implant? From my standpoint, you have to look at several different things. Number one is the age of the patient. Younger patients don't accept bigger implants as well because they're tight and they don't stretch out as well, especially if they haven't had children. If women have had children, they've already stretched out from pregnancy and from breastfeeding. This makes putting an implant in that much easier, and it makes putting in a larger, fuller implant that much easier. The other factor is muscle. Since most of the implants nowadays are put under the muscle, the status of your muscle makes a big difference. If you're heavily into working out, that muscle is very tight and there's not a lot of room in there. If you're more on the couch potato side, the muscle will stretch out and will accommodate a bigger implant even easier. Then the other thing that we have to look at is how big people actually want to be. What is their aesthetics of what they want to look like? And I basically put in the category of small, medium, large, and too big. So if you look at a profile, we would call that a small breast in profile. Putting a small to medium implant in will enlarge and expand that. If you go a little bit fuller, for people that want a more full look, the look that's a little more than natural, a little bit more done, where you have fullness up in here and really round cleavage. That is also doable with a larger implant. But there is actually a limit to the size implant that you can put into that space, because at some point it becomes too big, and this is not an attractive look. Because once that space is filled, the place that has the most give is the upper half of the breast. So instead of going from here to here, where it's bigger and fuller and expands in the lower part, that doesn't happen in the majority of people. And this is where the implant goes when you reach your max. And one of the parts of my job when I'm consulting with patients about sizing is what we call reality testing. And the best analogy I can give to people is it's like shoes. If you're walking down the mall and you see a shoe store, and you look in the window and you see a pair of shoes that you absolutely positively got to have, you can't live without them, and you go in there and you have a size 9 foot and all they have is a 7, it's not going to happen. No matter how bad you want those shoes, you're not going to be able to fit that size 9 into those 7 shoes. It's the same thing with your chest. Your chest actually has a size and an accommodation based on all the factors that I talked about: age, muscle, childbearing, and at some point it just gets too large. So no matter how much a patient may want to be a certain size, if it's over the capacity of their chest, it's not going to work. So what's the ideal thing to do when you're thinking about size? The first thing is, as I said, to go on the internet and look at different websites. Most plastic surgeons have good pictures. I have great pictures on my website. And you look at people who are roughly the same size and shape as you. If they have data for height and weight, that is very good, because the size of the implant is proportional to the size of the chest. It's going to be totally different if you're 5'4" or whether you're 5'11". So you have to have a comparable size person. Nextly, you can look at photos in something like Playboy magazine just to give an idea, and so you can show your surgeon what you're thinking of. A lot of times I look at photos with people, and sometimes they're telling me they want to be small, and the pictures they show them are anything but small. Other times they say they want to be big, but the pictures that they show are small. So words really don't convey the true meaning in a situation like this. The best thing that I've found is to do actual sizing, which is putting implants into the patient's bra in different sizes, such as 250 cc's, 300 cc's, 350 cc's, and so on and so forth, up through the numbers. 700 is the biggest number that I've done this week. The biggest implant that is made in the United States currently is 800 cc's. Those actually look quite good on somebody who's 6 feet tall. If you're 5'2", they wouldn't look good. They would look like this last picture on the right. So doing all those things and doing your homework, it'll help you to figure out what size you want to do. This brings us to the end of our tutorial. I'm Dr. Andrew Kaczynski of Advanced Concepts in Plastic Surgery, where art, science, and beauty come together for you. For more information, please come to our website, drkmd.com. Thank you.